Swapnil, people across the country, who've been through this pandemic, who know people who've had COVID-19, who've taken precautions, like I said, the fatigue factor has set in. Most people have started taking precautions and doing certain things, meeting small groups of people, inviting neighbors over. The small things where we let our guard down, I think most people have started doing them. And since nothing disastrous happens, they continue to do that. Are you saying that with these new variants, but also with the existing threat, all of that needs to be reassessed and reset? People need to stop doing even those things that they've started doing in a calibrated manner?
Shiv, so there's this, we convince ourselves that things that have kept us safe in the past are going to keep us safe in the future. Just because you got lucky 9 times in the past doesn't mean you'll also be lucky the 10th time.
So true, yeah.
So everyone should be doing everything possible to reduce their social contact. There are some people who do not have the privilege to reduce their social contact. Those of us who can reduce our social contact have to do it for our own safety, but also because we have a duty to lower transmission. And you're absolutely correct. With a more transmissible variant, things that might have been safe in the past, maybe going out once a week, that might have been safe for you. With a new, more transmissible variant, I think we need to reset all our rules. We need to assess the risk again very carefully.
One final question, Swapnil, is on the vaccine. And, this has been discussed quite a bit over the last few days. And Swapnil's piece on our website goes into a very well-explained detail on what we know and, very importantly, what we don't know and what the days ahead might actually, give us in terms of the efficacy of vaccines. We've had companies like Moderna, Swapnil, come out today to say that their vaccine, they expect it to be completely effective against these new variants, but they will need to do more testing. So that I'm assuming that's going to be the order of the day, that there is optimism that the vaccines will work against these new variants and future variants, but there is going to have to be a lot more testing on that front, Swapnil.
Right. So to put it very simply, on the cover of my book, if you look at this little blue part, it's the spike protein. And the spike protein has multiple different areas that our immune system can recognize. So if one part of that spike protein changes, the immune system can still recognize all the other parts. And people should feel reassured that the existing vaccines incorporate the entire spike protein. So we should have, some protection when we're vaccinated. We don't know right now even whether there will be some loss in efficacy. There will be. The important thing is that there will be future variants. And as more and more people get vaccinated, it's possible that variants will emerge that can beat some of the vaccines, and the vaccines need to be updated. But again, the good news is that if we keep transmission down, not only do we mitigate against all variants, but we also reduce the risk of future variants emerging. Really importantly and really quickly, Shiv, we talk about the efficacy of vaccines. But what we need to remember is that if we have a sudden surge in cases, and we have a large number of cases that occur now, the effectiveness overall of the vaccines in reducing the peak of the pandemic, because that's what we're looking at from a public health perspective. We want to reduce the peak of the pandemic. If the virus starts spreading more right now, and even if the vaccine is as efficacious, its effect on the peak of the pandemic will reduce. So that's the takeaway. We need to do everything to reduce transmission right now.
Are you optimistic, Swapnil, that there won't be any big consequences of these new strains in India? Most experts believe it's quite likely that the strain is already here. It's just a matter of detecting it. But do you see any big flare-ups? India has gotten things sort of under control. The numbers are low. The recovery rate is pretty good. Do you foresee any, big flare-ups as a result of these two new variants or upcoming variants?
Shiv, most experts are concerned about this variant. Its name is a variant of concern.
Yeah.
And with outbreaks in general, you have to respond really quickly. You can't wait till you have conclusive evidence that it's spreading widely or it's having a huge impact. You have to move fast, you have to move early, and you have to move aggressively. So irrespective of whether we think this is going to be very severe or not, we have to attack it aggressively and we have to act early. It's better to overreact than underreact. But yes, personally, I am concerned that this is going to have a negative impact on India's pandemic situation.